multiple bullet points in the skill. I'll tell you as I go with them, okay? So your patient's gonna be sitting in a chair. You're gonna be sitting in the center, and then, no. Patient's gonna be in the center. You're gonna be on one side. State tester's gonna be on the other side, okay? As juniors, we kind of did it that way when we practiced this skill, so that's how you'll do it when you guys practice now too. Patient in the center, you and state tester on the opposite side. So you come in, you introduce yourself, you're gonna explain what you're gonna do. I'm gonna take your vital signs. You're gonna wash your hands. You don't need gloves for this skill unless you so choose it, okay? She's just sitting in a chair. So first thing, you're gonna take your digital thermometer and your probe cover, okay? And you're gonna put it on. There's arrows that shows you which way it should be going on, okay? And then you're gonna take off this blue cover and the back cover so that it's just the clear thing on the probe cover. That's like one of the hardest parts for everybody, is just getting this thing on. You turn the thermometer on and you tell her, I'm gonna place this under your tongue, okay? And you hold it there until it beeps. This thing takes like 2 minutes almost, I feel like. But we'll wait for it to beep so that I show you the right way.
We gotta wear gloves.
You don't have to wear gloves unless you want to.
I'm wearing gloves. So I don't forget.
Sorry, you have to sit there. We're waiting for it to beep. See, the thermometer takes some time. I bought new ones, so they might be faster, but they're not faster.
Well, 3 to 5 minutes, whatever it beeps.
Okay, we're gonna say it beeped, right? We take it out, and there's a number that's showed on this screen. It says 98. I'm gonna write that down on my piece of paper where it says temperature.
So get a piece of paper.
You will have a piece of paper. Then you need to take off the probe cover and throw it in the trash. I don't have one near me, so we're gonna put it here with this piece of paper, right? Okay. Since the probe cover was on this, you don't have to clean it, but you can use an alcohol pad to clean this off if you so choose to, and put it back in the case, okay? First bold point is the temperature. You need to be within 0.1, I think is what your red book says of her. So basically, you need to be able to read this digital clock, this digital time exactly the way it reads, okay? I think that's, you all can read this. I remember that from last year. Nobody had any dyslexia with numbers or anything, except for me, right? Okay, so then next, a little bit, yeah. So then next, you and your state tester are gonna take your patient's pulse, okay? So you need to be in visual of the clock, or I have out little clocks, right? Everybody needs to be looking at the second hand as it goes around, and you have to tell your tester when you're starting. So I'm gonna find her pulse, right? My tester is gonna be using that arm and finding her pulse. And when I say go, we're both gonna watch this clock together and count for a minute and get a pulse for her. We're both gonna come up with a number. Hopefully mine, bold point, is within 4 beats of hers. So I either need to be 4 numbers above or 4 numbers below the number she comes up with, okay? So I count to my minute. When I'm done, I'm gonna write down my number. I'm gonna make up a number because I didn't count my minute, okay? Then I'm gonna tell her, okay, I'm gonna check her respiration. So this is, you can either say I'm gonna check her respirations, or you can do like we did as a junior and put her hand across her chest so they don't know they're doing it, right? But our actor knows we're gonna be doing that. So same thing, you're gonna look at the clock for your second hand and you're gonna tell her, okay, I'm gonna start counting her respirations now. And you count for the full minute. Third bold point in this skill is you need to be within 2 breaths of the state tester. So either 2 above or 2 below what she gets. Okay? And then you write that number down. Okay? And then if you had gloves on, you take those off, you wash your hands, you leave your patient in a safe situation when she's in the chair so she's fine, but you would give her her call light, you would say, and then you leave. And that's the end of that skill. People freak out about the numbers. Any questions about TPR?
You feel me? So it's the red hand.